Until this date, March 23, 2020, the number of COVID-19 cases surpassed 300,000 globally, and over 14,000 confirmed deaths. From all the research work published till yet, we know that this virus belongs from the large family of coronavirus, and now known as COVID-19. Older adults and people who have severe underlying medical conditions, like heart or lung disease or diabetes, seem to be at higher risk for developing more serious complications from COVID-19 illness. There is currently no vaccine which can prevent us from this virus. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. So the only way to be protected from this virus is to avoid being exposed to this virus. Follow these 5 steps to say goodbye to COVID-19. Number 1. The most important thing is to maintain social distancing. We know how big countries are going through lockdown in their cities so that the virus transmission from human to human can be cured. COVID-19 spreads primarily through droplets of saliva or discharge from the nose, when an infected person coughs or sneezes. So maintain a distance from people who are sneezing or coughing. WHO or World Health Organization advise to maintain at least 1 meter, 3 feet, distance between yourself and anyone who is coughing or sneezing. Number 2. Avoid touching your face with unwashed hands. Since the COVID-19 spread from the droplets of coughing and sneezing from an infected person, and also this virus can survive on the surfaces for a long time, that means if you touch that surface, you have a higher chance that it will be stick on you hands. Then, if you touch your eyes, nose, or mouth with your virus-contained hand, then there is a higher probability that you can get infected too. This is advice from every authoritative agency, that avoid touching your face with unwashed hands. Number 3. Frequently wash your hands, as we know that COVID-19 virus can hold on to the surfaces for quite a long time. That means the chances of transmission is greater, so you should wash your hands frequently, so that any germs or virus which may be on your hand can be washed out. And yeah, you should use an alcohol-based hand rub or wash them with soap and water. Sanitizers also works, but not better than soaps. Number 4. Keep respiratory hygiene. Basically, you and your people around you should follow respiratory hygiene. That means while sneezing or coughing, you should cover your mouth or nose, which makes sure that no other person can infected by you and by others around you. Number 5. Clean and disinfect frequently touched surfaces daily. If there is a surface at your place, which is getting touched very frequently, then there is a higher chance that, if a COVID-19 carrier comes in contact with that surface and you, too, then there is a higher chance that you will get infected by that. The best example of this scenario is lift buttons or public washrooms. And you can relate it with your home too, so avoid touching to many surfaces, or if it's important, then use something to touch it, like a pen in the lift case. And you can also clean the surfaces which are getting touched by so many people frequently. Most common EPA registered household disinfectants will work to disinfect